no one's coming to save me. Like to go from sitting in a spa to life support to essentially being disabled over the course of the month. Happy New Year. I'm home. I didn't know any of my diagnoses when I was discharged, other than, you're lucky to have survived this because the ventilator typically is a death sentence. No one is surviving this.
Yeah. I think that differentiation about or this disconnect between being you survived and like how broken you're feeling
Yeah.
is profound.
Yeah.
Was there times when you're like ever like, man, maybe I shouldn't have survived. This is so hard.
As I got into it, as I was adjusting to this new life that I didn't choose, there definitely were times like, well, what was the purpose? Like, it's supposed to be some miracle that I was saved and I have a life that really isn't worth living. My quality of life was zero for years. I mean, it just trying, I went back to work earlier than I probably should have, but I've thought back about it, in retrospect, and I've thought, why didn't I just get on disability? I mean, because the thought literally didn't even cross my mind of getting on disability, and I could have qualified. Heart failure, shortness of breath, and the thought didn't even cross my mind at the time. And I thought, well, maybe that's what I should have done. Maybe I should have just taken a leave of absence and gone on disability and just worked on rehabilitating myself. But honestly, making myself get out of bed in the morning is part of what was the beginning of saving myself. I had to get out of bed in the morning.
Was that conscious? Was that a conscious decision? Do you think that it was like, I've got to save myself?
Yeah, because I thought no one's coming to save me. Like all of a sudden, it's like to go from sitting in a spa to life support to essentially being disabled over the course of the month. Happy New Year. I'm home and I can't walk. I can't breathe. I can't think. I thought I had brain damage. My executive function was shot. All of a sudden, I have like adult onset ADD. I can't motor plan just to move something from one area in the casita to another. I can't keep a train of thought. I had word retrieval problems. So it was definitely affecting me neurologically, cognitively. I had a lot of neuropathy also at the time. And I don't know if I had just had whatever it did to my blood vessels, created something, or whatever neurological damage it created, but I had a lot of neuropathy. I had a lot of just joint and muscle pain. So I would force myself out of bed. And if I took a shower, then I would have to nap for a couple of hours because it wore me out because I couldn't breathe. When you can't breathe, it affects you on all levels. Like I'm struggling with the most basic activities of daily living, to be independent. I feel like shit. I'm scared. I'm grieving my life.
And you were cognizant of that. You of the fear of the
grief.
I
was absolutely so scared because I was limping, and the limping was painful. And I already knew my left side was messed up. And then I thought, now I'm going to blow out the cartilage in my right knee, and I was afraid I would fall. Neurologically, something happened to my motor system because I wasn't walking with proper gait, even beyond like the limping. I wasn't walking with proper gait. It was more of kind of a side to side walk. And I had to think to propel myself forward. I had to actually like make my motor planning conscious for how I was going to walk. And my balance was affected too. My balance is still affected. It's much better and I work on it, but it's still an issue. So I feel like I had every COVID symptom initially, and then I've been left with probably mostly inner ear and connective tissue at this point.
I'm always struck by what makes a person say, I'm doing something about this versus because there's a difference between I'm going to handle this and I'm going to deal with what's been given.
Right.
And saying, I don't want what's been given me. I'm
Yeah.
I'm going to do something. Some people might not even believe that there is something, and maybe in not all cases can you do
Right.
things, but it was just an avalanche of stuff for you. And so tell me a little bit about, because it wasn't all of a sudden. I mean, you were coping, you were dealing with it. Do you remember making a conscious decision like, this is not the life I'm going to have?
I didn't have like a systematic rehab program. I didn't have I didn't have what I needed. I didn't have some comprehensive approach where it was like, okay, you're going to be in PT 2 days a week. You're going to have OT once a week, and I would have only needed that shorter term, but I needed the physical therapy. I needed it desperately. And I needed to really build back my physical strength and my endurance. And I needed to be able to breathe and I needed follow up. And I really didn't have much. So basically, I started doing what I could because things were still closed, things were still on hold, people were waitlisted, there were shortages, and I was willing to pay. Take my money, you know? I need physical therapy. And so I tried a few different therapists that all had kind of different approaches. The one that I wanted to work with, I was waitlisted. One of them wanted to put me with see, here's the thing. I'm a therapist and I know the hierarchy of licensed therapist, assistant, and aide. And I know that aides are just people off the street that you train on the job. There's very little regulation. I don't want to work with a therapy aide. I know more than a therapy aide. I've supervised speech and occupational therapists for 30 years. I don't want an aide and I know the regulations, and I know how minimal the education, training, and supervision are. And so when I got home, what they sent me for home health, the only time they sent somebody, they sent a PT to do an evaluation, and then they were sending me a PT aide, and I declined it. And that and it wasn't just that the person was an aide, it was also that it was just going to be random sessions. Like they would call me at 8 o'clock the night before and ask me if I could meet at 8 when I was trying to get back to work. So no. They never sent any kind of like nursing kind of support or anything like that. I had a couple of follow-ups with cardiology and with my primary care, but just telehealth. And I mean, a cardiology telehealth was pretty worthless in my situation. Um, so I did what I could in terms of like getting PT when I could, trying different PTs to try to find a good fit and someone who had availability, and I was willing to pay for it. I did have a trainer and she was really useful to me because I had worked with her prior to getting sick. So we already had a relationship, and she would come over on Friday mornings and drag me out of bed essentially, would basically just nag me and text me and harass me until I got out of bed. And sometimes I still didn't. Sometimes I've canceled on her a lot. And she just kept showing up every Friday, 9 o'clock. Kelly, let's go. Let's get in the pool. She
Yeah.
wanted me to get in the pool and do like water aerobics with her. And I probably canceled half the time, short notice. Just like I would be appalled, like by like the inconsistency and the attendance. But I wasn't regulated. I was a mess. I
You
was
were
struggling.
depressed.
Oh yeah. And I would work during the week. And so then on Friday, I'm off and I just want to lay in my bed. I just want to rot in my bed because movement means I'm not going to be able to breathe, which means I'm probably going to lose bladder control, which means I'm going to panic that I'm going to pass out, and then I have to get myself into a Zen state because panicking is going to make the shortness of breath worse. But I would desaturate very quickly with exertion, and it was terrifying. And I would have to kind of use use the cognitive aspects to kind of override, the emotional, to try to get through that. But she would show up on Friday. She kept showing up for a long time, and sometimes she'd just come in. Sometimes she'd actually get me to at least the side of the pool. Sometimes I'd get in the pool or in the jacuzzi. It wasn't water aerobics. Sometimes she'd talk me into stretching or something, which always was helpful. And I'd feel better after, but it was just kind of motivating myself to get out of my bed and get over there. But the accountability of it did help. And her just, being my friend, the support of that, and just showing up and showing up and showing up. And like, I'll always be thankful for that.
So that consistency, time and time again, and being there, even if it wasn't a great workout, it was still therapy.
It was because I could talk to her.
Yeah. Yeah. And talk about anything. And going back to, I think, some of the humanizing experiences, I think we probably underestimate how important that is, because
Right.
part of this was having to address the depression. You've mentioned before the loneliness, the isolation. I mean, that's a big aspect, not only of course, COVID times, but also I think of the perceptions that we talked about before of there being like, great, you survived, and so we're done now. And so people kind of going on, like
And for
everybody
me,
kind of
it was
going
just the
on.
beginning. So, yay, you survived. Oh my God. We're so happy you're still here. This is amazing. And then people went back to their lives. And the world was still shut down. But over time, as the world reopened, people moved on. People moved on with their lives, and they moved on fairly quickly, as people would. And my life didn't really move on. My life kind of stayed stuck where it was.
And also the executive functioning was still difficult, right? In the
It
first years.
got better over time. I mean, I feel like my cognitive skills improved before my motor. I would say for at least a year, I had difficulties with executive function, and I masked it. And that took a lot of effort too. COVID was still new. It had only been around. I mean, the pandemic had been going on for 9 months when I got sick. There was no discussion of long COVID. Turns out that people were starting to, there were articles and there were guidelines, that spring and summer. People were talking about long COVID and people that were having kind of more difficult recoveries from COVID. But the people who were on ventilators died. And so I don't think that there was as much information for ventilators, survivors of ventilator dependent COVID, because they're dead. We didn't survive. So if only 2 of us survived that month, how many actually died? Because the ICU was packed. And I had mentioned there was like a day where just within 1 hour, multiple patients coded, and it was like that every day. It was a nightmare. And so I don't think there was as much information for patients like me.
Right. And that also contributes, I think, to that after effect we're talking about socially, because what everybody's hearing is like, hardly anybody survives. And then here you are, the termed Christmas miracle. You survived this great celebration, which of course you're grateful for, and everybody's happy. But it's, again, I think that's such an important point to emphasize. There's so much focus on that not realizing how bad that is afterwards, and what also needed to be included in that the aftercare,
Right.
From a social support network kind of a thing.
Right.
The isolation.
Well, and things were still isolating at that time because of the pandemic. And so I think, had this been a different situation, and I'd been in an accident or something, or I had been ill, even critically ill, there probably would have been a party at some point. Instead, it was like texts and calls and, things like that, where people were relieved. People were happy. People were relieved. My clients were relieved. People were, there was a whole vigil going on at my office with some of my client moms, and so people were definitely relieved. But for them, I felt like that's where it ended. She's alive, and I was alive with no quality of life, and my life had gone absolutely sideways. My life had imploded. It was no longer what it was on just, before my admission, or before my, I wasn't going back to that night in the spa before the cough. That wasn't my life anymore. And I wasn't that person anymore. I felt like a different person. I felt brain injured. And I really, truly believed that I had, that because of the hypoxia, that I had brain damage. And I mean, I feel like that's a logical kind of inference. And I remember saying that to Rihanna and her saying, I said, I've lost easily 20 IQ points. And she's like, oh, you had an excess, you're fine. And that didn't feel dismissive. That, because she's not wrong.
Yeah.
I'm still within normal limits.
Yeah.
Like I'm still above 100. I'm good.
Yeah.
But, and so because it was her, it didn't feel dismissive. Maybe somebody else it might have.
Sure.
With her, it didn't. But I wasn't right. I had to use word retrieval strategies that I used and that I learned in adult neuro classes that I barely paid attention to in 1993 to I needed word retrieval strategies for myself. And I would basically use circumlocution primarily. So I would go around and almost define the word that I was thinking of, or use a different word. I would generate a synonym. I would a description. I would just completely change the wording of whatever I was doing so that it wasn't obvious that I couldn't find my words. But then I would lose my train of thought and forget what the hell I was talking about in the first place. God, it was horrible.
How did that affect your sense of identity? Because you've always been so smart, cognitive, sharp. And that
it was horrifying.
Yeah.
It's like, what the hell is this? Like, I'm a speech pathologist. Like, I'm so anal about written language, and I have a good vocabulary, even if I don't always use it. Like, I have a good vocabulary. I write very well. It was insane. It was like a parallel universe. I'd entered the twilight zone, and it happened so fast. To go from just being a normal person, sitting in the spa, business owner, kind of coping through the pandemic with a glass of wine, and her phone, to, life support, and then coming out disabled.
And then you're fighting through it. So you were talking about the different self-care, the things that you were doing. And what I'm hearing is there wasn't a lot of debate, should I? It was just kind of like, well, this is what I've got to do. And you just started adding the things, finding the therapist that worked for you. And you were saying that the cognitive came back sooner than the physical.
Yeah.
That was still survival. And that's still, this is like, say, an year, 2 years
say
out.
I was in survival, I would say, for 2 years.
Okay. And how did that switch?
I gradually just started adding different things. I tried different things to kind of see what would stick. I tried different physical therapists. I tried different, injected supplements.
Let me ask a question.
Yeah.
Do you remember saying I'm having that kind of thought of this isn't living?
Yeah.
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 And did you ever during that kind of just survival time, did you ever just feel like giving up?
Yeah, absolutely. Probably the second year or at different times, within that first 2 years for sure, because what kind of life was this? And I was broke because I couldn't bill, I couldn't do therapy full time. I had my joint pain was overwhelming, and my process of getting to work that first year, I would, if I took a shower, I had to nap. Then I would hold on to my hand railing on my stairs, basically both arms, use all of my upper body to support myself, sidestep down the stairs, which a PT had told me to try for balance, sidestep down the stairs, kind of square off, and it's only 3 stairs, square off. I would then walk to maybe 20 feet to the jacuzzi. I'd sit on, it's elevated, so I would sit there to catch my breath and to rest. Then, and that's maybe halfway to my driveway. Then I would walk, I would sit there for a while, and then I would walk to my truck, and I'd have to will myself to somehow climb in because my lower body was still so weak. And my breathing was bad. And so I would will myself to get into this truck, and it's not like it's lifted. It's a BMW SUV. Come on.
Yeah.
I don't have big tires. They're low profile, you know? So I would get in and then I would have to modulate my breathing. I felt like I spent much of my time regulating my emotions and modulating my breathing because if I felt short of breath, there's this whole cascade that's of consequences. And I felt like I then had to emotionally regulate because if I panicked, I knew it would get worse. And then, and then I'm back to square one getting ready for work again.
And that was like just to survive, just to get
This
from
is
one
just
point.
to get in my truck.
Yeah.
So then I'd get in the truck and I'm miserable. I'm dreading even going to work because I feel like absolute crap and I don't feel like myself. Yeah. And I'm so unhappy. I'm absolutely miserable. And the business isn't doing well. I'm not managing it. We're still not taking new clients and I'm barely billing. People are still homeschooling their kids and they're not billing enough either. And the attendance is terrible because we have said, if you have a sniffle, you need to stay home. So financially, it's just a nightmare. But the reason I went back so early is I have a house and I have a business and I was not going to lose either. I was going to do whatever I had to do to save my practice and to save my house because it's everything I've worked for. And I wasn't going to lose those.
So that's what kept you going. And was there a little bit of the like moments with your patients you already had this relationship with and things like that would ever kind of remind you of your skills, or were you working so hard on trying to circumvent, your word loss and stuff like that?
I had to fake it at first.
Okay.
I had to fake it. But these were all existing clients and I didn't see all of them. And some it was just remote too. So I'd have to bring my affect up and that would take everything out of me. I'd have to bring my affect up to engage the kid over video, but it's not like it was physical. Yeah. It was really hard. I faked it for about 2 years where it had always been intuitive and natural and genuine. Here's the thing. I've done this so long. It's still better than what they're going to get somewhere else. And I have how much of my brain function? I'm systemic inflammation. I'm limping. I'm a mess. I'm depressed. I can't breathe. It's still better. Yeah. Because I could still educate parents on what they could be doing at home. And I did whatever I had to do to pull affect out of the deepest, out of the depths of my soul. I would find some spot that I could pull from and I would give that to them. And at the end of the day, I was drained. Even if I just saw a few kids, I was absolutely drained. But those kids also gave me the kind of motivation and inspiration to drag my ass out of bed, to literally limp to the car, regulate my breathing, get my caffeine, go in. I would kind of run my hand along our hallway wall for balance as I limped to my office. But I felt a responsibility to those kids. I know it's my one true gift in life is being able to help these kids. And it got me out of bed. And parents were happy that I was there. They were so relieved. There were 3 moms that, I was close with them then. I'm still close with them. 2 of them, well, I still talk to all 3 of them, but only one is still in the clinic. But these 3 moms were really, really just scared to death when it was happening. And so I felt like they gave me some room when I got back. They realized I wasn't, it was pretty obvious, I think, that I wasn't myself, that I didn't have the energy, and still having me was better than not having me. And so they just were thankful that I was there. And I remember one of the parents writing me a note and saying something about it. It was later, but saying, by those doctors saving you, they've also helped save my kid. And that was meaningful to me. And it was like the responsibility of seeing those kids. It's the same responsibility that had me choose to stay open during the pandemic. It's that same motivation. somebody had to help these kids. Everything was shut down. And I felt an ethical responsibility to see these kids. Was I at my best? No, but it was still better than most. And it had to be good enough for that time. Now, though, now I'm a rock star.
I know.
Now,
I know.
your girl's back.
And you could see that happening.
I know.
And see that joy and that light come back into you.
Totally.
And
no, I've changed a lot. This past 2 years has been just an absolute transformation for me.
Yeah. And you kept on like throwing things on there, seeing what would stick, because the fact of the matter was, it was never a question of you showing up. You were showing up. But it was a struggle, and
it wasn't enough support.
Yeah.
I didn't have anticipatory guidance. Yeah. I didn't have ongoing appropriate follow-up. No one, because my COVID was early on, it was the first year, they didn't have long COVID clinics.
Yeah. Yeah.
They didn't have the resources to provide anticipatory guidance or ongoing case management. I needed a comprehensive approach, and it wasn't available at that time. There are failures in the system, but honestly, a lot of it is because of this very specific context of being in a global pandemic. There were shortages of equipment. There were shortages of PPE. Medical professionals were living in their RVs so that they didn't infect their families. People were scared. People were dying. There were, my friends picking up corpses from freezer trucks while she has a new baby at home. I met that new baby, my nephew, through a screen door, took her dinner, and just got to kind of peek through the door while she held him 15 feet away, just to make sure, because I was working with the public.
Yeah. So that isolation also being such a profound part, and then compounded by this like harder, longer recovery than people anticipated and knew would be happening.
It was so much harder, I think, than anyone anticipated, myself included. Yeah. But honestly, I wasn't given a diagnosis or a prognosis or a roadmap of any sort. I really felt like I navigated this kind of on my own.
And you were just adding the things, and you were saying, okay, this is working for me. This isn't working for me. I think the act of taking care of yourself was something.
That took some time, honestly. Yeah. I don't feel like I didn't take very good care of myself the first 2 years. I was socially isolated. I was absolutely miserable. I was depressed. I was in constant pain. And then after working all day, I basically would pass out. I'd get home. I was emotionally drained. Physically, I couldn't do anything else. And I'd sit down, and I didn't have a couch in the casita. I had my bed, and it's like an adjustable bed. So I had it set up where the headboard is up. So that was everything. That was my couch. That was my bed, whatever. Well, as soon as I fell asleep really, really easily post-COVID. And I don't know what that was neurologically, but I could fall asleep, not at night, but I would get drowsy very, very quickly, watching TV or if I sat down. And so I'd get home from work, I'd sit down to elevate my legs, and I would pass out for a couple of hours. And then I would eat something crappy. And so I would just eat for convenience and taste and that quick little dopamine hit, because I don't feel like I was getting any kind of, my dopamine pathways were probably disrupted. Yeah. That's how I got dopamine, was just probably some carbs, something. I got into a place of just passing out and then just eating until I was overly full, and I wasn't getting any movement. So I was already struggling. My weight had already gone up during the pandemic, as we ordered in pizza or Thai or whatever every day. But it got worse, because then I would go home and overeat and, try to get that little 5 or 10 minute dopamine hit from the first couple of bites. And that, combined with being sedentary and all of the inflammation, and it was a mess. It made everything worse.
Yeah. And so what was it that then changed those aspects?
My cardiologist recommended Ozempic. So in how long has it been? Almost 3.5 years. I was kind of an early adopter, I think, of GLP-1s. And so he recommended Ozempic in 22, uh, summer of 22. And at the time, there were supply chain issues with that too. So I looked up, by then, see, my brain was working better. So I looked up a medical journal article and there was research on Ozempic and Manjaro. So looking at semaglutide versus tirzepatide and early trials and, looking at kind of different populations of people and what kinds of benefits they were getting from one or the other. And to me, it looked like Manjaro was getting better results. So I asked I told my primary care doctor at the time, said, hey, the cardiologist recommended Ozempic, but I'm looking at the Manjaro research. Can you order this? And he did. And so I started Manjaro in July of 22, and I didn't have guidance with that either. So I titrated up too slowly. My thought, my logic, because there wasn't guidance and it wasn't as common and trendy as it is now, right? My thought was, okay, I'm going to need to be on this a really long time. I don't want to plateau. I'm going to go up slowly so that I don't max out my dose in a few months. But really what needed to happen is I needed to get up to an effective dose. I needed to just get up as quickly as I could tolerate it. And I didn't have any issue with like negative side effects. I know sometimes with Ozempic, people complain of nausea. For me, I didn't have any kind of side effects with Manjaro unless I overate. So I stopped overeating. That was fixed. I would get stomach cramps, like painful ones, sharp stomach cramps if I overate. So I stopped overeating. And then gradually I would get food ick for certain things. And I was like, that sounds disgusting. And then other things started sounding better. So garbage burritos didn't sound as appealing as they had in the past, which probably saved me 1,300 calories, And so I just started slowly making changes, but nothing like structured or permanent at that point. Just I started eating a little bit more intuitively, probably reduced my portions. And I think it was also controlling my blood sugar because I was considered pre-diabetic at that time and my A1C had slowly been rising. But when I got COVID, I actually was at a diabetic level with my A1C. And I had wondered like later, because they didn't tell me till after the fact, why people kept harassing me about diabetes. I'm like, I'm not diabetic. I've never been diabetic. Like my A1C is whatever. And it turns out that along with everything else, all my other labs being off the chart, like I was diabetic as well, or my A1C was diabetic level. So I think it probably did help with like insulin resistance and prediabetes and my blood sugar management. And I started losing a little bit of weight. And in the last couple of years prior, when I would try, I wouldn't do anything sustainable. When I would lose weight over the years, basically I would restrict myself. I would basically restrict carbs. So I would do low carb. I tried low carb. I did like Atkins. I did a low carb, like diabetic thing. I did carb cycling. That usually is how I could lose weight, but I couldn't sustain it because I would start craving carbs and then go the other direction. I had previously tried a lap band. I had a lap band before it was fully approved here. I had one in Mexico in 2008. And that wasn't sustainable either because I had a hiatal hernia that was too close to the band. It would spasm. I vomited every day. So it eventually failed and it was removed. So, I mean, I had been trying things over the years, but as I got older, it was just getting harder and harder. And I'm sure I was in perimenopause, like when I went in with COVID, but it wasn't trendy in 2000, or in 2020. Perimenopause wasn't trendy. So I wasn't doing any of those things, and I hadn't researched hormone treatment. I was still on birth control just to control my periods. And so it just, it was a mess. Like everything was a mess, but the Manjaro kind of gave me some hope. It gave me this glimmer of hope that, look, I have barely made any of these changes. This has been pretty easy. And I would say I lost the first 25 pounds pretty easily. No, not fast, but over like 6 months, instead of gaining, I started losing.
And do you feel like that was a big impetus, like a big trigger for you being like, hey, I can do something. If this happened pretty
To some
easily.
degree, I mean, it gave
Yeah.
me some hope. I guess the combination of hope from that and then two really low points. So one of the worst points in this entire experience is I went to physical therapy, and I think it was 2022, I'm pretty sure. I went to physical therapy, and I was still having shortness of breath at that time. And she had me positioned on my back on a table, and then she was going across kind of a large room trying to find something she wanted to put under my head. Well, she had me kind of in a crunch and had my neck up, and so my airway, it affected my airway. And so I all of a sudden I felt the urge that I was going to have to pee. And I thought, "Oh my God, I'm gonna pee on this table." So I like she's talking, not really reading my like she's getting her things and whatever, and just kind of small talking, whatever. And then I remember putting up my hand and rolling onto my side to like cross my legs and kind of regulate myself so that I did not wet my pants as a grown woman on this table. And I roll over to my side, I kind of cue her gesturally, and then I heard static, and it went white, and I had a seizure. And I awoke to the same sound that I heard in the ICU of Kelli, Kelli, like from far away, like an echoey sound from far away. And she was yelling at me. I guess I'd lost consciousness for a couple of minutes. I was breathing, but she called 911. And it was a humiliating experience because I lost all control on that table. And I
As you
just
do with a seizure. I mean, yeah.
lost all control on the table. I mean, I'd never had a seizure, lost all control on the table. I'm mortified. And then I'm fully lucid when I wake up. I feel normal when I wake up. The paramedics come and check me out. They checked my blood sugar, they checked my blood pressure, I think they did an EKG. Everything was fine. I know that it was that I desaturated, and that I probably had underlying inflammation too, but I desaturated. And so, because this is what I felt coming when I would start to desaturate. So, in an effort to not piss the table, I destroyed the whole room. So, I get up, the paramedics come, there's a mess. I start cleaning it up, you know, and then she's gonna have another patient coming soon. Well, the water is turned off at this place that she rents from. The water is turned off. So I'm doing the best I can. I'm throwing things out, thinking I'll just buy new sheets, I'll buy new whatever, and I'm trying to do what I can, and then another patient comes, and then I leave, and I'm just like, what has happened to my life? I cried the whole way home. What has become of my life? I'm in a slight crunch with my head up just to get a pillow put behind my neck, and I'm going to destroy the entire PT office. So she discharged me from PT, liability, and said I would have to get cleared, medically cleared. So I asked my doctor to clear me, and he wouldn't because he said I needed to be seen by neuro, and I couldn't get in with neuro. I would have paid privately. I have a gold PPO. I mean, they paid $300,000 for COVID. Nothing. I couldn't get in, so I couldn't get cleared for PT. So that was it. And I did feel I was benefiting with that therapist. I really did. So that stopped. And I'd only been getting it on a wait list prior to that. Like we were just starting to increase the consistency of it, which is what I felt like I needed. And so that felt like a huge setback. Plus, I was scared to death about a seizure. So from that point on, that was in the back of my head and was giving me anxiety of, oh, if I move too much, because it's like I need to start moving, I need to get stronger, I need to get some endurance. But if I do that, I could desaturate. And what if I have a seizure? What if I pass out? What if the paramedics come? What if I make a scene? And that was in the back of my mind for a long time. So that was 22. That I started the Manjaro that summer. I had the seizure also that summer. And then I was getting some PT as I could. I tried a couple of other places. Nothing was really it wasn't what I wanted. You know, a somebody gave me a gymnastics coach, some little girl, like literally a teenager, gymnastic coach who was going to motivate me to walk on a treadmill. That's what was recommended for me. That's not why I went there. So that didn't work out. So I talked to the owner and then I left. And then I tried somebody else and he was trying to double bill me and my insurance. So that didn't really work out either. And I didn't have the bandwidth to fight and I didn't like him anyway. So I tried a few. I've tried every physical therapist and like stucco guy in Redlands, I swear to you. So
And if we want, comments, referrals, we can ask
right,
you.
just ask me. Like they have different lists, right?
Yeah.
And so it'll
Kelly's
be
list.
Kelly's list, and it's going to be specific to physical therapy and stucco.
And stucco. Okay.
Yeah.
So that's our project board.
Right. So I tried to get on with a couple of different people, and then I started with a new doctor in February of the next year. So February of 23, I'd already been on Manjaro for 6 months. I'd lost 25, 30 pounds by that point. Met with her. She, I think, seemed a little overwhelmed by how sick and injured and wrecked, I still was, but she seemed up for a challenge at the time. And so I started working with her. I had been very resentful of my primary care doctor, who was my doctor during COVID. I remember getting my concierge medicine bill while I was in the hospital bed, like this is your, like it was like a late payment notice on that. And I had wanted to switch at that point because it was just telehealth and I knew I was going to need more. But I remember the nurses at Loma Linda telling me, don't make any changes right now. You're going to need referrals and orders and you're going to want to have somebody who already knows you. So I stayed on. So I finally switched after 2 years. She was very helpful. She did a physical that day. I was still a mess, but doing a little better. I still had shortness of breath, but it wasn't as horrifying. I had lost a little bit of weight. I was encouraged by that. She made some referrals to specialists, and like got me caught up with like labs and like imaging and those kinds of things. I had done some stuff on my own. Like I saw my dentist right after because one of my hallucinations was somebody chipped my tooth with the tube. So I made sure to see the dentist. So like I saw the dentist, I saw the eye doctor, I saw the audiologist, I tried PT, but I really needed a referral to pulmonology and rheumatology. And so she did that. And also I was going to try a different cardiologist. Well, the cardiologist didn't work out, but the pulmonologist is fantastic. I just got lucky. It was just, the referral was just to the department, but I got somebody who's fantastic. And she's done a pretty comprehensive workup over the last 2 years. Love her. She also got me to do a sleep study, and she explained to me why sleep apnea is so dangerous and basically how it affects the heart and kind of the fight or flight response that it would put me into multiple times an hour while I was asleep. And she really explained it to me she recognized me not just as a patient, but like as a human, but also an educated woman. And she spoke to me in a way that just resonated. And so we set up a sleep study. So she's been my pulmonologist since then, but she follows me for sleep and for pulmonary. But she was going to graduate me, I think, from pulmonary because I'm doing like my breathing's great now. So she did this full assessment. She had me do like a chest CT and nuclear medicine. And we did the hours long, it was like 3 hours of pulmonary function testing. She said I crushed it. It included like that 6-minute walk. Yeah. I did all those things. I didn't desaturate. And what was most meaningful to me is that when they got my heart rate up to like 80% of my max or something on a treadmill, and I was struggling because of my leg strength. But I was breathing heavy, but more than normal breathing with like exertion, not like drowning, not like I can't get enough air, and when I realized when she discussed it with me and talked about the results, I realized that I didn't desaturate with exercise, even with significant exertion. And I I had stopped exerting myself because I was afraid. I was afraid, and it was like more of that loss of agency and loss of self because I had stopped moving because I was scared. I was scared that with physical exertion, I'm going to pass out. I'm going to have a seizure. I'm going to kill somebody on the road. Like, and so I kind of conserved I
Mhm.
did the bare minimum of movement.
But then you were able to see that you could do more than you thought you were capable
It
of with
gave me
that.
the confidence that I could do more. And so after I passed those tests, I made that was a turning point. Like I will always thank her for that. I made an appointment with another physical therapist, like number 7. Love him. He evaluated me and he recommended that I work with his trainer. He has a PT assistant who's a trainer because I'll take an assistant. I'm not taking an aide and I'm not taking a gymnastics coach or a teenager. So he set me up with his guy who's a PT assistant and a trainer. And he was saying that one of the things that the guy really likes to work on is boxing. And that was something that I had previously done in training that I enjoy. So what we would do is when I first met with him, I met with him in November of 24 after my eval. And I had one session before I went on vacation. And when I met with him, what we would do is like more whole body exercises. So we would do like whole body squats, body weight squats. We would do ring pulls, different things, pretty basic and like slowly. And he'd encourage me to rest. We would do like medicine ball slams, some of the stuff that I still do, but like at a very slow rate, and we did the ski machine a little bit. We would just do some basics and we would do that. And then at the end, my reward per my request would be boxing. So I'd box like for 10 minutes, could not breathe. Like, but because of the exertion, because I had no endurance, and I hadn't done anything like this in years. But oh my God, I loved it. It was my favorite and it was a reward. And so we set up weekly appointments and it started out where we did it in that way. We would do whole body for like 20 minutes and then boxing for 10. And I couldn't really tolerate more than 30 minutes at that time. And then the PT also kept an eye on me. And then now I still work with them, but I work with the PT once a month. He does like balance training with me for an hour. We've been doing that since June. And then I still work with my trainer, but we just do boxing. Or I'll have him do like manual PT stuff on me, like when I have an injury from working out.
Yeah.
Which is a very different type
Because
of
you're adding
physical
that
therapy.
too.
I
And
have.
so, yeah, you're
So I
working
started
out. Yeah.
with them, and that
Yeah.
kind of gave me, it's one-on-one. It's a private gym, private PT gym, and it's, at most there's going to be like one other client there. And so it just working out there one-on-one just kind of gave me the foundational skills and the confidence, combined with the knowledge of the pulmonary function labs. Like, okay, I'm not going to desaturate. I'm okay. And he would just encourage me, take a break, take some deep breaths. You're okay. You got this. And I would take some deep breaths and I'd bring my heart rate back down and I was good and we'd keep going. And I absolutely loved it. And so then I did that for a while. I started that in November. And then I started walking around the neighborhood probably by like February or March, but I don't enjoy walking. And so I thought, well, let me substitute something that I would probably enjoy instead. So I got a gym membership and I started strength training. So I'd already done some stuff with Q, with my trainer. So I started going just to 24-hour and doing strength training. So but I kind of went hard with it. So I started going like 4 or 5 days a week. And I started seeing like calf muscles and getting really happy about it. And I would be able to push more weight. Every time I was there, I could push more weight. And it's so easily quantified, strength training. Compared to like the scale is not as linear. It's not as predictable. I could be putting in the effort that's necessary. It may not show on the particular day and time when I weigh, and I weigh once a week and I document it. So I've learned that I'll document that once a week because I don't want my head to be in the sand. But I rely more on kind of these, people call them non-scale victories, but I call them little wins, and I have been hyper focused on little wins for like 2 years, but especially I would say this past year and since I started training. And so now what I'm doing is I don't enjoy going to the public gym. It's dirty. People are scrolling on their phones. I get irritated waiting for machines. I don't enjoy it. So I'm building a gym at home instead. So I have boxing once a week. And then I there was a friend that I wanted to see whose daughter used to be my client, and you know who this is, and I
Yeah.
love her.
I know, me
Well,
too.
she strength trains like an animal. She's so strong, but she's also has that kind of Hawaiian spirit about her where
Yeah.
she's so warm, so welcoming. Like I have always loved her.
Mhm.
So we had said forever, like, that we were going to work out together. And so I said, dude, I'm working on it. I'm trying to get to where I won't embarrass you, you know? And so I finally went with her. She got me a guest pass, and I went with her to the gym I'm going to now, where it's a private gym, but it's strength and endurance classes. So it's group, but with a trainer. And I went once just thinking, okay, I'll just go once. It's going to be too hard for me, but I'll go try it because I can see Fran, and then she'll probably buy me coffee after, and we'll get to catch up.
Yeah.
So I went with her, and she had already kind of prepped the trainer that I'd need some modifications and kind of what I'm coming back from. Trainer was cool. I really liked her, and I worked out for 50 minutes. I've never worked so hard in my life. And then Fran bought me coffee or breakfast, and so I joined, and I absolutely love it. And I already have made, just from joining the gym like in July, so from July till now, the improvement that I've made in my strength and endurance is crazy relative to how slow I felt my progress was for 2 to 3 years. My progress this last 2 years, really, that there's the miracle. It's the work that I've put in. I have worked my ass off. I've had people, I have made sure to like seek out the supports that I need, and it's become easier to get those supports now that the world is open. But I decided last year I'm going to make this my self-care era, right? And so I just threw everything at it, and with some intensity and frequency. So I already was doing some basic self-care things. Like one of the first things that I started doing to take care of myself after I was discharged was like skincare, because that would meet my need for like obsessive shopping online. I didn't have to go somewhere. I could just, look on Instagram, see what people are recommending, whatever. And so I started like obsessing on skincare. Well, my skin started improving because I was consistent and using good products. And I now am doing that kind of stuff with like gym stuff. I'm a little obsessed. It's kind of ridiculous. I just bought another pair of Adidas weightlifting shoes because who doesn't need
Oh.
two for 2 sessions a week?
I'm gonna
But
have to get all the tips from you. I didn't even know about this magnetic bag thing,
oh, I'm
so
about
that's
the magnetic
amazing.
bag,
Yeah.
but you have to get the real one.
Okay.
Don't get the knockoff. It's not worth the $20 you save. I was doing just as much self-care stuff that I could that would be functional, but also just make me feel better because I felt like shit for so long. I have barely any pictures of myself between, I have a few pictures, like one on the ventilator that is just appalling, one when I was sick, one on the ventilator. And then I have very, very few pictures for the next 3 years because why would I want to document that time? Now I over document because I know that even if I hate whatever picture it is or video or something, that later I'm going to be happy using it as a progress picture. And so I've done just that. And over time, I've become very open about sharing my progress because people will say, oh, it's, like you inspired me to get off my ass and go for a walk or they'll just kind of gas me up on my efforts. Um, and I know that it's been encouraging for certain people. One of my friends is a recovering alcoholic, and like she'll send me messages, and she'll gas me up, but she'll also just be like, dude, that totally motivates me. Like, I want to pick your brain about, the gyms that you're going to and whatever. And so it's like, if the misery that I've gone through, if sharing some of that misery and sharing some of my progress can help other people, like I'm so down for that. Like that squishy pediatric therapist heart of mine, I want to help other people. I had to be able to help save myself first, but now I do feel like I'm in a position where like, maybe I can help other people with aspects of the story because there are certain things that I've learned like from my struggling, from just absolute misery. There are things that I've learned that I've applied to my life that have helped.